Welcome to Beyond the Buzz, where curiosity meets clarity. I'm Dr. Tara Moroz, scientist and communicator with decades of experience translating complex human research into clear, evidence-informed insight. This episode looks at bladder leakage, pelvic floor exercises, and treatment options, because the message can swing between "it's normal, live with it," and "try this fix." Maybe leakage is affecting exercise, sleep, travel, confidence, or daily routines. That can leave people unsure whether to ignore it, search for answers, or ask for help. Mixed messages can waste time, money, attention, and concern when a private health question gets reduced to one-size-fits-all advice. To bring a clinical perspective into this conversation, I spoke with Dr. Adrian Wagg, an internationally recognized incontinence expert from the University of Alberta, whose work includes bladder health and incontinence in aging. Full disclosure, Dr. Wagg is also my husband. Let's take a closer look together, starting with what's driving the buzz. Urinary incontinence means leaking urine when you do not mean to. The online question is not just, "Is this common?" It is this something I just have to live with? That question matters because urinary incontinence is common. One large U.S. survey analysis focused on women aged 20 and older found that 63% reported urinary incontinence, or about 6 out of 10 women. That represented almost 80 million U.S. women. The cost is also substantial. Across EU countries, the estimated 2023 economic burden was almost 70 billion euros. That analysis included both males and females, while finding that females carried about 4 times the burden of males. So the buzz is understandable. When something is common, costly, private, and surrounded by simple messages, it is worth asking what those messages leave out. Let's check the evidence, our kind of receipt check. This is the moment to pause and ask the questions that matter. What's the evidence? What's the source? And how do we know? Here's what the evidence shows. The evidence points in 2 directions. Urinary incontinence is common in women, and treatment options exist. A lot of the evidence we're looking at here focuses on women, especially pelvic floor muscle training and stress leakage. A Cochrane overview found a wide evidence base for conservative treatment of urinary incontinence in women. Conservative treatment means non-surgical treatment. Pelvic floor muscle training is one of the best supported conservative options. Pelvic floor muscle training means exercises for the muscles that help support bladder control. A Cochrane review comparing pelvic floor muscle training with no treatment or inactive control treatments found that it can cure or improve symptoms in women with stress urinary incontinence and other types of urinary incontinence. That gives pelvic floor exercises real evidence weight, not just wellness buzz. But pelvic floor exercises are not the whole story. A 2024 Cochrane review compared different ways of doing pelvic floor muscle training. That matters because the evidence is not only about whether pelvic floor training can help, but also about how it is delivered and supported. The type of leakage also matters. Stress urinary incontinence means leaking with pressure or exertion, such as movement, coughing, or physical activity. Overactive bladder is a different symptom pattern linked to urgency, frequency, and sometimes urgency leakage. So the practical answer is not just do Kegels and not nothing can be done. The better answer is identify the leakage pattern, then match the treatment discussion to that pattern. So why does this resonate? Because both messages offer a kind of relief. It's normal, live with it, can make leakage feel less alarming. Try this fix can make it feel solvable without an awkward conversation. One message says leakage is just part of pregnancy, exercise, menopause, aging, or having a body. Another says one exercise routine can fix everything. That combination can be powerful when something feels private, inconvenient, or easy to minimize. The tension is that both messages can sound useful while still leaving people unsure what applies to them. That is why this topic sits between everyday reassurance, online searching, and one-size-fits-all advice. So I wanted to ask what this looks like in real clinical life. To explore that, I spoke with Dr. Wagg. Dr. Wagg, when people ask whether bladder leakage is something they just have to live with, what do you wish more people understood?
Many people believe that bladder leaks are a normal part of being a woman or getting older. Because of this, some people just live with it. They may buy pads, avoid going out, plan their day around bathrooms, or change their lifestyle in ways that are frustrating or inconvenient. But leaking urine is not something people should simply accept. It's common, but it's not normal. Getting advice early can help.
Thank you. Bladder leakage is often talked about as part of aging, but it can happen for different reasons. What is helpful and what is unhelpful about the aging message?
In older adults, bladder leaks are often not caused by aging. They may be linked to other health problems such as heart disease, constipation, Parkinson's disease, memory problems, or trouble getting around. Some medicines can also make bladder leaks worse. For this reason, it's usually better to look for the cause rather than saying, it's just aging.
Great insights, thank you. A lot of online advice jumps straight to pelvic floor exercises. When are pelvic floor exercises useful? And when is that message too simple?
Pelvic floor muscle exercises can help many people. These exercises can help support the bladder in people with stress incontinence. They can also help people with urgency incontinence by making it easier to hold urine for longer. People usually get the best results when they're taught how to do the exercises properly and have follow-up support. However, pelvic floor exercises are only one part of treatment. They can take at least 4 months to make a clear difference. They also work best when combined with other treatments that address the bladder problem and any other health issues that may be making the leaking worse.
Thank you. The evidence separates stress urinary incontinence from overactive bladder symptoms. In plain language, how should people think about that difference?
There are different types of bladder leakage. Stress incontinence happens when urine leaks during physical pressure or movement. This might happen with coughing, laughing, sneezing, lifting or exercise. It's more common in women and it can also happen in men after prostate surgery. Overactive bladder's different. It causes a sudden, strong need to pass urine that's hard to put off. This is called urgency. Sometimes people leak urine before they reach the toilet. These types of bladder problems are treated in different ways. That's why it's important to understand what's causing the leakage before choosing a treatment.
Thank you for that clarity. And a final question. If someone has been quietly putting up with leakage for months or years, what would you want their next step to be?
People should feel able to speak up and ask for help. A family doctor, nurse, physiotherapist, or other healthcare provider can give advice. Online symptom checkers or self-help questionnaires may also help people prepare for a conversation with their healthcare provider. Bladder leakage is still a topic many people feel embarrassed to talk about, but it's a health problem and help is available. There are many things that can be done to improve symptoms and make life better.
Amazing. Thank you, Dr. Wagg. And yes, full disclosure again, I do also get to ask him these questions at home. your evidence edit moment. So what's the takeaway? Urinary leakage is common, and the evidence supports treating it as a health issue with options, not as something people simply have to accept. Pelvic floor muscle training is one evidence-supported option, particularly in women and as part of conservative treatment. Treatment can also include broader guideline-based discussions, depending on whether the pattern is stress urinary incontinence or overactive bladder. What we don't know from a simple social post is which pattern someone has, which approach fits best, or whether pelvic floor training alone is enough. A reasonable decision lens is to ask 3 questions. What kind of leakage is this? What options fit that pattern? And what are the trade-offs? That is where a real clinical conversation can help. Identifying the leakage pattern, discussing the options, and weighing the trade-offs. Common is not inevitable. Treatment is not one size fits all. Something to reflect on. When you hear a simple message about bladder leaks, does it help you understand the pattern? Or does it make one answer sound like the whole story? If you found this useful, follow Beyond the Buzz and share it with a friend who likes a little science with their scroll. You can also explore the full transcript, the clarity poll, and evidence in the evidence edit. Until next time, stay curious and stay kind to your mind. This is Beyond the Buzz, cutting through the hype because evidence is empowering.